Hey guys, Dr. Scott Nall here from thevillageosteopath.com. So I was cleaning up my hard drive last week and I found a folder I hadn't looked at in a while, and I popped it up and there's a bunch of videos in there. And I looked, and sure enough, I had filmed some question and answer stuff about 2 years ago, never released it. So I thought, wait, why not just make a little intro here to kind of update some things a little bit, to let people know these were old videos, and have my video guy mix it all together and put them out there. It does have good content. I will apologize, the camera I was using back then wasn't nearly as good as the one we have now. Audio is going to be a little bit bad, lighting was bad. I did have better hair, but you know, hey, we'll take what we can, right? I hope you enjoyed the videos that we found in our hidden folder on the hard drive, and hang around, and I hope you'll get some good information out of them. Thanks a lot. Hello everybody, Dr. Scott Nall here from the Village Osteopath and Indie Regenerative Medicine. Today I'm going to be answering the question, what in the world is a neuromusculoskeletal specialist? Actually, I don't get asked this a lot because most people can't even pronounce it. But that is the specialty that I did a residency in, and that's what I'm board certified in. So I thought I'd at least explain it so you guys know exactly what it is that I do. And actually, that is usually the question that I ask. Every now and then someone will come in as a new patient and they'll say, and I'll ask them, how can I help them? And they said, well, could you exactly tell me what it is that you do? So neuromusculoskeletal medicine is a very small branch of medicine. There may be about 300 to 350 of us in the whole United States. In about another 3 years, there will be more of us because up until that point, only osteopathic physicians have been eligible to complete the residency program. In 3 years, MD graduates will also be able to enter the program and complete it and become board certified as well. Neuromusculoskeletal medicine is a branch of medicine that deals with treating the full range of problems that have to deal with musculoskeletal system. So your bones, your joints, the ligaments, the muscles, all soft tissues. Pretty much anything has to do with you being able to move around. That's what we deal with. I like to tell people what I treat is things that hurt but aren't broken. Because broken bones tend to fall into the area of orthopedic surgery. Although I do treat some fracture management here in the office. And so I do this through a holistic look at the musculoskeletal system. So it's not just part hurts right here, so let's deal with that, because the musculoskeletal system is affected by the whole body, and the whole body is affected by the musculoskeletal system. They're very reciprocally interrelated. And so when people come in with pain, we not only look at the part that's causing pain, but maybe that pain originated somewhere else. Maybe the body's always had a problem there, but for some reason it started to decompensate, and now you're starting to feel pain in that area. And so why is that? And so a lot of times we'll do blood work here in the office, hormone levels, we'll look at, check your blood sugar to make sure there's no problems with a metabolic process that's going on. We'll look at x-rays to make sure there's no arthritic changes going on or possibly underlying cancer that could be causing the problem. I also utilize musculoskeletal ultrasound here in the office, which can look at soft tissue issues. So there's a lot of different things we can look at here in the office that typically you won't find in other offices that deal with pain. For instance, if you were to go to a rheumatologist, rheumatology deals with pain quite a bit, but they're going to look at it from a rheumatological standpoint. So they're going to make sure you don't have rheumatoid arthritis or lupus, and they do a lot of lab work, and we'll check for joint effusions and synovitis to make sure you don't have swelling. If that comes back okay, then they're probably not going to be able to deal with it. If you go to the orthopedic surgeon, they're probably going to take an x-ray, maybe an MRI, look mainly for arthritis, and as long as that's not there, they're going to say, yeah, you're not a surgical candidate, please go do physical therapy. If you go to a physical therapist, here in Indiana we now have direct access to PT, which I think is great, but let's say you go to the physical therapist, they're going to evaluate you more from a muscle standpoint. Say, is this muscle tight, is this muscle weak? Let's stretch the tight ones and strengthen up the weak ones. If that's not the case, if there's something else going on, they're not going to find that. Let's say you go to your family doctor. Well, that's kind of a roll in the dice as well. Your family doctor might have good musculoskeletal training, or they might not. If not, you might just get a pain pill and say, yeah, it'll probably get better on its own. Let's take this pain pill and we'll see how you do. Maybe you go to a physiatrist, a PM&R physician. They might do some spinal injections on you. And so there's not really a lot of people out there that are able to put the whole complete picture together. And that's really where my specialty fits in. It fits in somewhere in between surgery and your family doctor. So if you're not a surgical candidate, or maybe you've been told you're a surgical candidate and you're just not quite ready to go that route yet, family doctor really doesn't know what's going on with your musculoskeletal system, you probably need to be seeing me, because that's where I do most of my work. And as far as treatments go, the treatment plan is very individualized. It could end up being something that needs to be manipulated through osteopathic manipulative treatment. It could be something that needs to be injected. And we have a lot of different injection techniques here at the office we can utilize, from standard steroid injections to low-dose steroids to prolotherapy to platelet-rich plasma to even adult stem cell procedures that we can do to help with advanced arthritic pain. It could be something that you need to go to physical therapy for, and you need a physician who actually understands what physical therapists do and are able to help direct that and help your physical therapy become more effective. I see a lot of people who say, oh yeah, I've been to physical therapy, and I say, well, what did the therapist do? And they say, well, they put me on a bicycle. Then I'm like, okay, well, that's probably not what you need to have done. And I said, well, what did your doctor tell them to do? And they said, they didn't say it. They said you can go to PT. And so it could be their doctor didn't understand what physical therapists did. They just thought, well, we'll send them there and see what happens. And so someone who maybe is a little bit more knowledgeable at how physical therapy works, which I've had extensive training on that and worked with a lot of therapists here in town. And so if you do have a musculoskeletal complaint and you feel like you're not getting anywhere with your primary care physician, and you feel like maybe surgery is not the next best step, well over 90% of the time surgery is not the next best step, come on in and give me a try and we'll see what we can do together. Thanks a lot. All right, and there you have it, another great lost and found video. I hope you enjoyed the content. Please like and subscribe and share it around with your friends. If you have any suggestions about further content that I could do later on, just leave it in the comment section below, and I'll be glad to get around to that as soon as possible. And once again, this is Dr. Scott Nall from thevillageosteopath.com, helping you restore health and optimize your life.